emerges in the perineum together with Du and Ren Mai. It is located in the sagittal center of the body, as representing man between heaven, Du, and earth, Ren Mai. From this position, it promotes the development and expansion of the individual upwards, therefore prefiguring the body structure. The character Chong has several meanings: crossroads, great communication route, impulsion, fountain, bursting, vigorous, powerful, impetuous, as well as colliding with or pouncing on. In clinical practice, we may detect a deficient Chong Mai in people with a weak constitution, low vitality, and a passive disposition. This extraordinary vessel is also usually implicated in the cases of fatigue, whether physical, sexual, or mental, in chronic depression, and also in individuals living in the grip of fear. Chong Mai is the fourth extraordinary vessel of the trunk. It emerges from Hui Yin, Ren Mai 1, just in the perineum, and from there it rises sagittally between Du and Ren Mai through the center of the trunk to reach the head. It basically expresses the individual power in each one of us. The crossroads that Chong Mai represents makes it the great coordinator of all organic processes. Consequently, its most common pathology is the global alteration of the circulation of qi. So broad a dysfunction can manifest itself with symptoms as varied as hot flushes, headaches, asthma, or constipation. At the same time that physically structures the being, Chong Mai also governs the development of its mental framework. For this reason, we must think of it when faced with subjects with difficulty in taking responsibility or making decisions as a consequence having not mentally matured, especially when the person fails to organize themselves efficiently, when everything in their life seems to be out of balance, or when they report anguish, restlessness, anxiety, or obsession. A person with a blocked Chong Mai is often an uncomfortable patient who boycotts the medical examination by being reticent or openly distrustful. Remember that the character Chong also means to bump into or pounce on. Fortunately, after the regulation of this meridian, such belligerent attitude generally disappears. There is a kidney point, kidney 16, which is at the level of the navel where the umbilical cord that nourishes the fetus starts. And it is called Huangshu. Shu means to carry, to offer, and Huang refers to a structure in Chinese medicine that wraps and nourishes the internal organs and is comparable to connective tissue. And some French authors, among themselves Jean-Marc Espy and Jean-Marc Queisalet, claim that Huangshu resonates with the physical and emotional nurturing of the mother throughout the intrauterine period of pregnancy. Now, think about a woman who is pregnant of an unwanted child, or maybe another distressed because she has had previous miscarriages and fears losing her fetus, or still another anxious or frightened by any external circumstances. Then the fetus they carry on, while developing themselves, are receiving all the physical and emotional magma from the mother's livings. And that's all their world. And this is the basis causing chronic anxiety in very many individuals. From the beginning of their lives, since their most tender development, just have been living with all this fear, derived from the unconscious remembrance of the fear of losing their lives. And this anxiety state and permanent restlessness
which has been internalized very deep down at their core indeed, but at the same time in a seemingly unmotivated way. So, if we have reason to think that there were such kind of circumstances in the intrauterine period, by puncturing Huangshu, we often get the person to calm down. If it works, the result is very stable since a first, second, and eventually a third puncture, more and more spaced out. And to me, this is the beauty of the acupuncture theory, the possibility of it to be contrasted by means of a single puncture, and of course, for the help that this can bring to so many of our patients.
In order for life to develop and perpetuate itself, transformations are essential. Just as Chong Mai is a fundamental meridian for organogenesis in the fetus and the development of the reproductive system, this extraordinary vessel stars in periods of transformation such as puberty, pregnancy, and the climacteric. Therefore, Chong Mai should always be taken into account when facing a psychological resistance to change, be it work, housing, or condition, because they all require the capacity to mutate. In such cases as these, it will be necessary to choose, among the Chong Mai points, the one that reproduces the physical symptoms of the patient. Greater or less, they shall always be present, since an energetic dynamic that does not flow properly always has side effects. Clinical experience shows us that the stimulation of the target point, in addition to resolving the physical discomfort that made the patient come to us, is also helpful to facilitate the transition process that triggered it.